And so, what we're saying is, if you find these either in your loved ones or with yourself, where I think most entrepreneurs say, I'm God, so they'll know,
Okay,
right?
okay.
So, how do they approach that?
See, first and foremost thing is that no matter how good you are, okay, usually no matter what you have achieved in your life, okay, you're not immune for depression. And once you're depressed, no, some people might feel that okay, I'm going to take care of this by myself by doing that procedure, all of those things. Maybe it may be beneficial, but maybe it may not be sufficient. Okay, it may not be sufficient. In that case, it's best to seek out help. You can either reach out to a clinical psychologist or reach out to a psychiatrist, whatever it's possible. Discuss the problems with him or her and see what needs to be done. Whether you have to undergo treatment with antidepressant medications, or you need therapy in the form of cognitive behavior therapy or any other forms of therapy, that is best decided by the clinician.
So, what exactly is cognitive behavior?
Cognitive, see, one thing is that you feel depressed because it's a manifestation of your own thought process. I I'll give you one example. Let's say today something bad went, the meeting was not so favorable. Okay. So you start generalizing. All my meetings are not favorable. It's been always been happening in a bad way. So you tend to generalize that. That is the faulty way of your thinking. Okay, so in depression, a person gets depressed because it's a manifestation of his own thought process. Right. So in therapy, cognitive behavior therapy, what a therapist he or she does is that they tend to find out what are the faulty ways in which a person is thinking. Okay, they'll highlight that and then they'll try to modify those thoughts. So once those faulty ways of thinking has been rectified, the person's depression will automatically come down.
So you're basically saying you go and basically take the person on a journey of his thought process, and then you basically try to give him a different journey. So his behavior
exactly. Cognitive behavior therapy, because your behavior is controlled by your cognition, your thought process. Right. Okay, so by modifying your thought process, you can modify your behavior also. So that is one form of treatment. Right. Probably some patients may respond to medications. In some patients, medications might not be warranted. Right. In some patients, both may be beneficial. Right. Combination of both. Medications as well as therapy.
And that CBT. Is also a point of stigma. I think a lot of people don't want to go to a psychiatrist because they get medication.
You can always discuss. It's not that the psychiatrist is going to show some medications into your mouth. Okay, you can always discuss about the possible options you have, and along with that stigma attached to psychiatric medications, people usually say that it has got lots of side effects, it's dependence potential and all those things. No, nowadays there are newer medications with less side effect. One thing what you need to understand is that any medication, whether it's plain paracetamol tablet for fever, everything, if it has to have positive effects, it's bound to have some side effects. So even psychiatric medications have also got some side effects. I don't deny that. Right. But whenever a doctor is prescribing you medications, he would have weighed the pros and cons of it. He would have weighed what are the benefits of taking the medication and what are the side effects which is expected. And only when the benefits far outweigh the side effects, only then he is going to prescribe the medications. And just in case if you have got any side effects, you are always free to come back to a psychiatrist and discuss with him, so that the medications can either be altered or dosage can be changed. Something can be done, but definitely medications are definitely going to be helpful.
Right. And for those who are just stigmatized against medication,
the thing is that first of all, it's each and every individual's responsibility to reduce the stigma. First and foremost, we need to understand that just like any other illness, even this is illness. It can happen to everyone. In fact, psychiatric illnesses, depression is on the rise, and India is going to be the depression capital in the coming next decade. Right. Okay, and it's an illness, it can happen to anyone. Okay, it's not necessary that it's because of my own mistake I'm getting depressed. No. Okay, without me committing any mistake, it's not under my control, it can happen to anyone, and it's biological. Okay, so once you know this, then probably the level of stigma comes down. Okay, and it's not a sign of weakness. Just because I am depressed, I am reaching out to a psychologist or I am reaching out to a psychiatrist doesn't mean that I have failed in my life, I am weak, and that's the reason why I am seeking help. You have broken your leg, you go to an orthopedician to get it fixed. Right. That's not a sign of weakness. Right. Similarly, in this case also, you are depressed, you seek out help. Okay. Right. So I don't see any difference in both the cases.
So if I can just take it into field of sports, and it's more or less like. If I can compare it, I'm not playing well. If I play basketball, so if I'm not shooting well,
True.
I'd basically go see a coach,
Exactly.
right?
Exactly.
Not it doesn't mean that I am not capable of doing
True,
this.
true,
It just
true,
means
true.
that I may. It may help if I
True.
reach out to certain people,
True.
and those certain people are known to correct these things that are not necessarily just giving medicine.
Exactly.
It's not just the medicine.
Exactly. Exactly.
Right?
That's how
So
it is.
I don't punch in a steroid just to make
No,
me
no,
play
not
well. So
necessarily. Not necessarily.
it's
not
also
necessarily.
important that you understand the technique
On the
of how
point.
to deal with
Yes,
things.
yes.
And,